And then you want to, you'll feel it, and you can have the patient cough.
Hello everyone, Dr. David Kulla here with Synergy Wellness, Chiropractic and Physical Therapy. Today we have Melissa, and Melissa here has an interesting case, and probably several of you watching this video have had this happen to you. If you have ever fallen down a flight of stairs or slipped on the ice or slipped roller skating, rollerblading, and fell flat on your back, right on your tailbone, on your fanny, on your butt, then you probably subluxated your coccyx bone. Your coccyx bone is the little tip of the sacrum, all the way at the bottom of your sacrum. It's a very, very tip right above the hole of the anus, and right where the bottom or middle of the butt region meets, okay? And it's a very tiny tip right in the center. And if you have pain sitting, or doesn't even have to be sitting on a hard surface, it could be sitting on a soft surface. Why don't you tell everybody what kind of symptoms you had a couple weeks ago?
So I had really bad pain coming down the back of my spine, all the way to my butt. Do I turn to the camera?
No, you're fine.
All the way to the bottom of my spine. So whenever I would sit, sitting for the center of my butt bone, it hurt more here. And then the pressure would be shooting straight up. So you can't, I couldn't sit normal like anyone would normally sit without feeling some like shooting sharp pain. I couldn't sit on the floor, bent down. I couldn't sit like crisscross applesauce. Everything hurt the center of my butt.
Crisscross applesauce?
Yeah, that's my daughter's term.
Gotcha. That was the first. Okay, never heard that one.
So with my legs crossed, it would hurt too much to extend my pelvis, because I would feel the sacrum and tighten up. Get really tight or sore.
Okay. And what about other things like
walking?
Walking was difficult for
Yes.
you. Sitting was very
Sitting
difficult
was the
for
worst
you.
part.
Can you imagine, especially if you have a sit-down job,
Yes.
sitting at a desk? How do you work? And walking or standing, was standing difficult too?
Standing too long. If you stand it for long periods of time still, the pain from my spine would just shoot up. So I would feel it lower and then all the way to the center of my spine.
Okay, and then you also have a desk job, correct?
Yeah, so I use a donut and it still hurt.
Yeah, so she was using a donut, all sorts of seat cushions.
Yeah.
And how long has this been going on for? How many?
A year and a half, almost 2 years.
A year and a half. And what have you tried up until this point?
I tried physical therapy. I've tried really just chiropractor, adjusting my hips.
Okay.
And that was it.
Okay, so she's been to physical therapy and she's been to other chiropractors. And she's doing, how are you doing at this point? How much percentage improvement are we at in a couple weeks in?
A couple weeks in, I'm almost like 75 to 80% better.
That's great. So what we've done, I'm going to fill you in, folks. What we've done is a special technique. And I haven't done it. Dr. Kelly here, you're going to see him perform the technique. It's called Logan technique, and it's specifically for this condition. And in really rare cases, we actually have to go internally in through the rectum and adjust the coccyx. And in her situation, obviously that's always a last resort. So we've gotten 75% improvement. We're going to go through a couple more weeks here, and we're hoping that she gets 100% improvement so we can avoid the internal adjustment through the rectum, because it's really uncomfortable, and I mean, anyone can figure that out. It's not fun. So we want to avoid that at all costs, and so far we've been able to do that. We've been successful. So Dr. Kelly here is going to explain or show you the Logan technique, and either he or I will explain it as we go along, okay? Check it out.
What we're looking to contact is the sacrospinous ligament, which goes from the bone that you sit on. Melissa, I'm going to touch the bone that you sit on.
Okay.
Okay, so from the bone that you sit on, and then you want to follow the sacrum down to the tip of the sacrum. And then you want to, you'll feel it, and you can have the patient cough, and you will feel the sacrotuberous ligament, sacrospinous ligament.
So for you folks watching, what he's doing is he's basically releasing several of the ligaments that hold the sacrum, which is a triangular bone, to the pelvis. And there are 4 ligaments on each side, on the left and the right, 4 main ligaments that hold, again, the sacrum to the pelvis. And the sacrum, at the bottom of the sacrum, is the coccyx, which is what we're trying to adjust and shift for her. So what he's doing here is releasing some of the tight ligaments and rebalancing out the sacrum, okay? So is it uncomfortable?
It was the first time. This time
Okay.
it's not too uncomfortable.
Okay, there you go. So the first few times, and she was already in pain anyway.
Yes.
You know, we're about 4 weeks in to
Yes.
treatment here.
Yes.
So, I mean, she had the 75% improvement, I would say, like a week or two ago even.
Last week.
Yeah, okay. So we still have a little ways to go, but she's improving day by day, visit by visit. Now I'm going to let Dr. Kelly do his magic. So thanks for tuning in, folks, and you know, you can kind of just walk them through. You don't have to get too scientific with the folks out there on YouTube, but...
Yeah, so it's about 10 minutes to do this technique.
Okay.
And the patient will get very sleepy and almost
Okay.
want to take a nap afterwards. And you want to, you know, feel the paraspinal muscles, and, you know, you'll feel them relax, and then you go
As
up
you're doing that.
as you're doing this, and then you'll go up all the way up to the occiput.
Okay. All right, great. When you do this technique, Doc, do you just do it on that one ligament, or are you doing all 4? Or are you specifically picking that one ligament because that's what's going to...
Yeah, I'm picking this one side because when the sacrum is rotated, there would be tension, as we've seen on the x-ray. The sacrum was rotated this way.
Yeah.
So I'm going here on the ligament here to kind of ease the tension and center the sacrum.
Okay. So yes, folks, we took x-rays of her on the exam because of the trauma, the fall that she had. And we did see that her sacrum was rotated. So you heard Dr. Kelly. So if you guys have any questions about Logan technique or about a coccyx adjustment, or if you've fallen on your tailbone and have a lot of pain, feel free to comment below. We'd be happy to answer any questions you might have regarding coccygeal pain. Thanks for tuning in.